It is, 9 a.m. So that's the our meeting to order today. Of the, Community Health and Human Services Committee.
I'm sorry.
We are called to order, roll call.
Francis Bunkerson,
Here,
John Bob Price.
John Bonifatice is on the meeting. He's,
Okay.
yeah, he's muted currently. He cannot be, and then he'll be able to talk.
Brad Olson, Cam Garden. Here. Tony Johnson.
Here.
William Oliva.
Here.
Rita McKee. Dave Menke. And Dr. Love. Thank you.
and with that, I'll entertain motion to approve the agenda, please. A second,
Second.
okay. Any discussion? All in favor, signify by saying aye. Aye. Opposed? Okay, moving on, agenda item number 4, approval of minutes for the November 12th, 2024 meeting. I'll entertain a motion to approve.
I'll move to approve.
Second it.
Any discussion on minutes? No? With that, all in favor signify by saying aye. Opposed, same sign. Okay, agenda item number 5, public comment, for 3 minutes, not to exceed 30 minutes total. Do we have any members of the public here or online for any comment? If not, then that we do, so with that, I will move on. Agenda item number 6, receive information from supervisors not stated as committee members. Everyone here, Jay. Have anything for us, Jay? Okay. Moving on, the agenda item number 7, Golden Age Manor update. Dana, yes.
Hello, thank you everyone for coming. Thank you all for coming to the Amory today. So just a few things, here, things are going well, wrapping up the year. It's always fun here at the nursing home for the holidays with lots of decorations and entertainment and fun, so it's good. We just wrapped up a kitchen project, so we did a capital project in our kitchen to, replace the flooring, to replace the ceiling, new paint, a few new, fixtures as far as a refrigerator, a griddle, things like that. It was a long time in the works, that project. As you can imagine, it was, a challenge to coordinate. We were able to utilize, dishwashing at one of the churches in town. And we kind of just made do. We used disposable dishes, for a lot of the meals, and took about 3 weeks to get that done. So the staff did a great job. The contractors did excellent, keeping on track. So we were able to get back in the kitchen for Thanksgiving dinner, which was great. So that's been a really, nice project to get done. We recently hired a staffing and recruiting specialist. So, she works about 30 hours a week. She does our staffing, scheduling for the nursing department and also recruiting for the whole facility. She's only been with us about a month, but she's doing a great job, getting some of our vacancies filled. We have a couple, retirements of nurses, professional nurses, which were anticipated. So, trying to fill those right now, which is always a challenge, especially those licensed nurses, LPNs, RNs. So that's kind of the focus for recruiting right now. We are still working on the international workforce, as most of you, kind of know, we've been working on for several years now. November 27th, I got, actually November 21st, I got notification that all of our cases were, filed for the Department of Labor and approved. So now we're in step 3. It's a 4-step process. So step 3 is filing with United States Citizenship and Immigration Services. So, the organization we're working with, an attorney, their team works now on the next step of the process. It's been a longer process than what we first anticipated, which you're all aware of as well, but It's still moving along, so that was, exciting to get, one step further in the process. As far as the time frame, I unfortunately don't know exactly. I don't know, they don't think they know exactly, but it's still moving forward, so we'll continue to keep you updated on that. With staffing, we also, are almost coming up on a year of our in-house CNA classes, so through a January class schedule that is full already, so we've certified about 12 CNAs since we started. Our full classes are depending on, age of the staff, it is, it's, 4 to 6, so it depends on if they're all over 18, then they can all be trained on the lift. If they're not, it kind of changes the dynamic of the class. We like to have 2 that are under 18 paired up together, kind of thing, so that's why it varies, but, we continue, getting people through that class, which again has been a huge, just a huge blessing to us as far as staffing, because we're able to train them right here, in the facility and get them on the floor quicker. The only other thing you probably, people hear in the news and, you know, with Medicare Advantage plans, health partners, managed healthcare, there's lots of, changes and things happening there, so we continue to watch that and stay on up to date with who has contracts with who as far as Medicare Advantage plans, open enrollment period with our residents here, so, so yeah, that's kind of been one thing that's had a lot of change here at the end of the year, but, otherwise, any questions? Yeah.
So for the third step, for people that
Yeah.
get a green card then, and then they're eligible for it.
Yeah, I think that's kind of where it's at. They get, I'm not exactly sure, but yeah, that's basically what I think step we're on. Then they're able to come, and then after they come, their families are able to join them shortly after, which is of course the big reason why they all want to come.
Right,
to the United
and
States.
so with that green card then, I mean, you have a local immigration lawyer working on that? Or-
It's through a company, it's called, International Manpower is the company, and they work with this attorney, that works for them, so that's all she does.
Okay,
So that's what she works for that company.
just one additional question.
Yeah.
With your human training.
Yeah.
Are they trained like online, or are they trained by staff? here?
Yeah, good question. So our class is a hybrid, so they do 40 hours of online theory, but it's broken up throughout the course. So it's a 75-hour course, 40 hours is online, and the rest is in the facility here.
With the staff.
Yep, so we have an RN who is certified to be a trainer. She had to do a little bit of extra, training herself to become a trainer. And so we do the 40 hours broke up over about a 3-week period, and then the skills days are kind of intermix there. So they don't do all 40 hours and then come here. They'll do maybe 10 or 15 hours, and then they'll come and they'll go over the topics that they covered online. So they do 2 skills days and then 2 clinical days. So skills days are up in our lab on our north wing, which I'll be happy to take anybody on tours. We have a great space up there. We have 2 beds, 2 mannequins, all the supplies. So they work on the mannequins, they work on each other for certain skills, and then the last 2 days are on the floor assigned to residents here in the building.
I guess my question is around you have adequate staffing support, or if you pull somebody out of your care.
Yeah, I know.
Do you need more help?
Right, no, the person who does the training, she kind of wears a lot of hats. She does the wound care here, she does the training, she works on the floor, so she's not like a full-time person we're pulling. She works it into her schedule. Yeah, so it works out well. Yep. Yeah.
Anybody else have any questions for Dana or comments? No? Not, and we will move on. Thanks for that report.
Yeah.
And item number 8 is our ad hoc committee report. Time. Brad isn't here. Are you able to take that report?
I can explain it for you guys.
Okay.
So the ad hoc, you might be familiar with, the committee that was formed by Chairman Luke back in, was it May? Did you call us together?
something like that, earlier this summer. And it was a result of, the HSHS hospital closures in the Chippewa Valley, so St. Joseph's Hospital and, Sacred Heart Hospital, in Eau Claire, along with the, Ellie Phillips, the center in Chippewa Falls. So as a, way to work on, being able to get some resources on the western side of the state here, Chairman Luke called us together to figure something out. I guess that was the purpose of it, right? To figure something out. Anyway, so we started out with our local, Polk County group. The resolution that Supervisor Olson sponsored got circulated through the state. There's been some good response on other counties or municipalities, sponsoring their own resolutions to send off to the state. And that was primarily for, putting a building in this area for us to use for, emergency detentions and crisis. So while that all is going on, we kind of had an ad hoc to the ad hoc group that also got formed with a few other counties to address the more immediate and long-term needs of, more than just putting a building in to serve this area. So we've been working all summer and fall on, what is the status and what are some ideas to help us, help those people who are in crisis service, in need of crisis services in our area with the absence of facilities and or other services. So we put together the white paper, so you can read through that. It's just a look at, where we're at, the drain on resources that it is for law enforcement as well as our community services. The law enforcement pieces that the officers are tied up for hours on end, calling people across the state. For community services, it's more about people in need having the worst day of their life, having to get part of the hospital, the state, as well as the cost to our budget. So this is all addressed in there. I think the findings of the work group is that we would like to have a facility closer to us. But we would also like to have some sustainable free services. So if there's a way we can divert people from needing to go into a locked situation, we would like to do that instead. So more like crisis stabilization centers. And what would that mean in terms of, I think there's money up front that would be available potentially, but they'll put some of it. So our hospital partners that we've talked to, that's the first question they've asked. What about long term? We're not gonna be able to walk into this and have some money to build a building, but then, 5 years down the road, there's no sustainability in the vehicle. So that's what we've been focusing on. In the meantime, while we're doing all of this work, the innovation grants came out. They finally dropped. So that was part of the budget, this last budget cycle. So those just dropped. They'll get carried over into the next budget cycle. I think it's July of 2025 is when the application does. So those are grants that municipalities and local governments can apply for, to partner with other counties or municipalities, private sector, to meet a need. I believe that we are working on one for law enforcement. But we're meeting with the Regional Planning Commission Friday to talk about what that could look like for some crisis stabilization services in this area. So that's in the works. Just real preliminary, there's still not a ton of guidance on it. But we'll work through regional planning on putting our application together and along with those other, like mostly the bordering counties. So our Polk County, Barron we'll let them have a bordering county, but they've been very interested and active with us. St. Croix County, Burnett County is interested. So, where we have the highest demand, counties that will jump on with us. We did entertain a contract with Alliance Systems for interstate compact. We got all the way through writing the contract with all of our interstate compact agreement language in there. And then basically in the 11th hour, they said, we need to focus on Minnesota. we have so much work over here that we, maybe some of that. So, out of that, we formed a workers of those, directors and human services to look at other facilities, since we've already got the contract written up and we've got everything kind of set in place to be able to have, out of state crisis services. So we'll work with those other facilities and then, down the road, to see if we can get any contracts with them. So it'd be a lot closer for us to have over cities than home company to or other. One of the kind of the cool, just a visual, the last page here, we laid out all of the crisis beds in the state of Wisconsin, and I think what pops out to me is that there's no service. There's very little service on the side of the state. So you're covering a real large area with very few beds. Anything southern, eastern is gonna be a haul no matter what. So if it's Winnebago, if it's Milwaukee, if it's even Ashland would be a haul. So, so that was a nice visual. I think this has been distributed out to the other human service directors in the western region. They're doing whatever they need to with it, advocacy and sharing out.
Question, yeah, when this was first discussed, there was, discussions about or issues with legislative restrictions about transporting people. So has that been resolved when you started writing the agreement with Alina, and even though they backed out, so some of those issues been resolved?
Yeah, in statute, remember the exact number, but it's in statute that you can do interstate compact. We spelled it out very nicely for us
Okay,
on everything.
so then even when we first talked about it, it wasn't the fact that we couldn't do it, it's just that we needed to actually have a compact. We couldn't just say, hey, we're shipping across state lines. No, we actually have to have an agreement. That was the,
Our states have to agree.
Right.
Yeah.
okay, because I knew there was some issues with the state lines, so.
Yeah, and, who's gonna pick the person up, who
Right.
remains responsible financially.
Right.
all of that.
So as long as there was a compact written up, okay, thank you.
It's same as child welfare.
Sure.
Interstate compact. I don't know that our process for vehicles would be as stringent as for children. Interstate compact, they actually have a social worker who works, the two states work together with their social workers.
I have a question. Has there been any discussion at all with health partners, about any type of expansion here in Emery or with, their facilities, Hudson, Stillwater, Nourishment? We moved my fair, huge actually,
That health partners, local here, and there's like, as far as I know, there's no plan to expand to 10 beds. And I think that has to do with how they're licensed and certified and critical access and all that. So, and I know that they are also building a new facility in water, but, yeah, I believe so. But I don't think there's crisis services attached to the one in the water.
that it wouldn't be so.
Oh, yeah.
I see that the rate at Winnebago is went up to $2,100 per day.
For the first 3 days,
25?
yeah.
What is it at? Oh,
It actually went right now. It's, now, October it went up.
okay, it did. What was it before then?
Oh, boy, I think it was
Did it take a huge
15,
jump?
1700, yeah, it was a pretty significant jump for us.
Okay.
Most of that is not covered by insurance, Medicaid. There's a lot of hoops to jump through, so usually that rolls back to the county to be responsible for that. So when we send somebody to Winnebago, the nice thing about Winnebago is that they don't have waiting lists. They accept everybody. Their bed capacity is 300 and some, but for staffing, you'll see on the map, they're about a 184 census. That's what they can handle. So that's the nice part, but the other part is, once we get the bill, and try to collect on it. So they've done their due diligence, they've worked it through insurance, they've tried to do ability to pay with the person, and everything has been exhausted by that. By the time it hits our books, which we don't write them a check, they just take it from our allocation. So we don't know if we're coming or going sometimes based on Winnebago collections, and we could start out our year 2025 in the hole because we had all these Winnebagos that came through and didn't have the money to pay for it or insurance, so we have to pay for it.
So I'm sure that somebody's done a cost on this. So if you send somebody to Winnebago, and let's say that it cost you 2,100 a day just for the patient,
Yeah.
the client.
Yeah.
Okay, so what does it cost the sheriff's department to ship them, for transportation services? Any idea what that costs?
Oh, I guess I would, average with a benefit package for a law enforcement, maybe $50 an hour-ish, give or take, and if they're spending 8 hours in transport or 16 hours, there's a lot of the delay is in wait times for clearance to get, medical clearance to get to, the actual transport, how much?
$800, $1,200.
800 to 1,200.
It's almost, to bring it in perspective, like having one full-time employee for that. Very expensive.
We've been able to do some virtual, because after, there's 3 days, 72-hour hold, they have a probable cause hearing. They used to have to come back and appear in person, now some of it's done virtually. And sometimes if we do have to bring them back, we don't have to take them back. They could be multiple trips back and forth when they go. If there's not a place, if they do determine that there is probable cause, they could go back because there's no place for them. So we might be sending them back to one. And it has to be secure.
Like to think, yeah, I like to think Tanya, she's done a lot of work on this ad hoc and with multiple counties, multiple legislators, which, she's currently setting up a meeting. First week of January.
Strangled Jeffy James at the Wixom conference last week, but we need to have a meeting, so we're trying to figure that out, between the first week of January, to bring all of those stakeholders back together, to talk about here's the paper, here's what we're doing, what kind of brainstorming, not what they want us to do.
There's been a lot of work on that she's done on all these different options and avenues from multi-state agreement. Looking at expanding beds and how do we incentivize people to add beds to the units and all that stuff, so. She's turned over a lot of rocks and had a lot of meetings with other counties on this and hopefully get some traction there with the legislators. In the next couple of weeks.
Do you have anything else? Or- Well, I
Nice job on that project.
Yeah,
Well done.
thank you.
Excellent.
Yeah, there's a lot of very hard work into it, and the staff and department and throughout the whole committee, so thank you very much for everybody who's been involved. That's all right.
Contact with legislators, who, bills that authority, Claire. I know they passed some money for it, but
I just saw in the news, they're looking, the Chippewa Valley Cooperative, I think it is, that collaboration that got together, they're looking at reopening St. Joseph's Hospital in Chippewa Falls as a mandate to services until that hospital is built. Yeah.
well,
But that won't include emergency, crisis services,
they won't.
it's just primary care. Mhm.
I had, last Friday, I had the county consortium for Wisconsin Department of Workforce Development. And they were discussing what they're doing for, to get staffing for that and for the, kind of the limited menu, so to speak, of services and getting that up and going, and they're really doing a lot of hard work and a lot of hustling on there.
St. Croix County is going to receive a grant from the state to open their old nursing home for the dementia crisis. So that will be helpful for us. We'll plan on contracting and there's an open house coming up. I can get that sent out to you. I can do this Thursday after work. But that will help out a little bit, but it won't need anything. It's not, no, it's not. Yeah, if you have questions, let me know.
Okay, we'll move on then to our next agenda, item number 9, which is an update regarding housing. Mo, you got anything for us?
A no new application.
You have everything you need on the other one?
Yes.
Okay, very good. Agenda item number 10, our communicable disease report. Let me show, hop on here. Okay. Hi, Helen. Peter. Don't remember.
Okay, sorry, everyone. It took a little bit. Um, Okay, communicable disease report, pertussis, whooping cough is on the top of our list. So in 2024 throughout Wisconsin, there's been 2,136 cases of pertussis. Polk
Hold on,
County
Helen, we can't quite hear you.
Oh, sorry.
Too. Try to talk again.
Yeah, how's this? Any better? Check, check.
Coming through yours too. Okay, I think it's better. Just speak up.
I will, yeah. Pertussis cases. There have been 2,136 in Wisconsin in 2024. In Polk County from August through yesterday, we've had 14 pertussis cases. Most of them are in individuals 18 and younger. In Wisconsin, there's been 85 infants hospitalized with pertussis, no hospitalizations in Wisconsin. Thank goodness. We've had no respiratory illnesses, hospitalizations in November, but already in December, we're seeing some. We've had our first influenza A hospitalization, and we have a COVID hospitalization too. Other than that, just a handful of, 5 STIs. November was still high with tick-borne diseases. So now we're moving into that respiratory season. Any questions? Thank you.
Things down for us. The pertussis, I'm just curious, is that concentrated in a specific area where it's like people are catching it from other people, or a specific school district, or?
You're muted.
Okay. It's not just in one school district, it's across a few. There's some individuals that aren't even associated with a school district that have caught it. So I think it's just the sheer number of cases in Wisconsin. So our contact tracing approach with someone with pertussis is anyone in their immediate home gets prophylactic or is offered antibiotic treatment prophylactically. And then we do kind of that contact tracing back to identify any high-risk individuals. So if there's anyone pregnant, immunocompromised, we would encourage them to talk with their doctor to see if they would recommend some antibiotics just to be on the safe side. So it's more just spreading that awareness, but we're not doing any, like if you've been exposed, you need to quarantine at home. That's not the case with pertussis.
Thank you. Rita has a question for you too, Helen.
Are you tracking at all on these pertussis cases, whether they've been vaccinated?
We are, I believe 13 out of the 14 cases we have had been vaccinated.
They had been. Okay, let's.
So I know the state is tracking that, and I think my question in my mind is like, when did you have that vaccination? Is it 15 years ago? That's different than if you've just had it too. So that might speak to why Polk County hasn't had any hospitalizations. Potentially.
Do you have any other questions or comments for Helen's work? No? Dr. Rogers, do you have anything for us?
Well, I know that I'm bringing through the channel 4 again for the, for process in Minnesota. And, ranging from, age 2 to 92. So it's possible, for adults who have been vaccinated, that their immunity has been waning over the years. So it depends on your, amount of contact you have with people you, that are, revaccinate. So I have treated people when I was still in practice, 70, picked it up from a grandchild. That's for tough, so, not unheard of, and, again, I think, there's been so much misinformation about vaccines, fortunate for not getting vaccinated. Do we know, did you, find out anything about what the rates were for people in schools for, exemption for vaccination?
That we, should know that information. Have that idea.
With the question about school immunization rates,
When we look more.
The rates of, the amount of, influenza is still pretty low, but I think, and when I get my, influenza vaccine today or tomorrow, and so that we get together with family members, but not giving it to them or getting it from them. They're still recommending, influenza and COVID boosters for people over 65, especially where it is. And that this group is still recommended, like your Michael Osterholm still recommended to get these two shots 6 months apart. So, and, people who are immune compromised, i.e. they're on chemo or something, they really need to get their COVID booster every 4 months. Talk to their oncologist about that. But COVID is alive and well. I think the last data that Dr. Osterholm presented was at the beginning of November. There's still 175 people dying every week from COVID. And most of these people are unvaccinated. And then most of the people over 65.
Just a quick comment. It's hard to know what exactly will happen with the Department of Health and Human Services in the cabinet, but I did go ahead and make the senator from the senator regarding, regarding the concerns about that ideology, and I think if that does come to pass, then I think it's incumbent on healthcare providers to really educate. And I think, because it's gonna have to fall back on local providers.
Right, local health departments, local providers.
And local, yeah, one-on-one provision. I'll advocate. Thank you.
No, thank you, Rita, for doing that. Do you have anything else for our disease report? Doesn't look like it. So our next agenda item number 11 is our administrative update, so Mo, you're on for that.
Here, just a couple things, sales tax finally in November went in the black, 0.8%, so that was good, ready for the budget. We had talked about our health plan for the county and benefits, looking at going out for RFPs, in 2025. We're gonna push that to 2026 and look at, redesigning, our plan for 2025, and 2025 is going to go over RFPs with better numbers. We have an MOU with the Fair Society for the grandstand project. They agreed to all the items that were discussed in closed session, so that project is moving forward. I'll have 2 appointments for the county board meeting one reappointment for BOA and one reappointment for the library and system board. And then the outdoor rec plan had its public hearing on December 3rd and passed, public works, public safety, and that'll be at the board for approval on the 17th.
Thanks, Phil. Anybody have any questions? On any of that information? Doesn't look like it. Okay, agenda item number 12 is our 2025 work plan. In our online package, there is a draft of that for our review. It appears to be pretty much along the same lines and format as it has been in prior years. Is there any changes in that we should be aware of, Tanya or no?
No, this is, it's a working session, so, if something comes up during one of the months where we want to have a program overview or some other item,
So we're looking,
yeah, so I think all of the key benchmarks as the, dam report, the financial reports, and then, the public hearing. Do you still want the meeting agenda items? Holding, legislative event and ad hoc committee. For the legislative event, that was something that we have typically done. We would meet on St. Clair County, we would pull local legislators together. We talk about the issues of the day. With COVID, that went away, and it's something that I want to propose to the Western County. During that time, very valuable to build relationships with the legislators, and so they know firsthand what.
I know that, Monica and I frequently attended those legislative events that have a response to at that time to, put input from the county and put where our issues are and, our priorities and what they could be helping us with funding and other programs for public health.
Yeah, so that will be one of my.
okay, anything else there? Looks like we need to take Governor Yacht. Note that as well. I know y'all will be showing up. February, wondering what the meeting is. Not. Okay, it's my poor sense of humor. Okay, agenda item number 13 is our legislative event report. Do we have anything there? Is Johnny online? Does he have any reports or no? Okay. Does it sound like that we have anything new going on there? Jay, anything you know about? No?
No.
Okay. So then we will move on to agenda item number 14, subject matter for our next meeting on January 14th. Does anybody have anything that they want to see specifically that would depart from our work plan? Actually, our work plan has, 1, 2, 3, 4, probably, five things we're covering there, which is a healthy agenda, but if we have anything else that we need to touch base on, we want to make sure that we do that as well.
I just wanted to make an announcement about something happening in March, because we don't have a February meeting.
Okay,
That would be the time to do it.
yeah,
And I think I could work with the Veteran Service Officer to announce that regarding, an event in March that's gonna be for suicide prevention in the county, as well as veterans homelessness. And it's about, sleep outside kind of thing with the cherry feed and that kind of thing. And that's gonna be a conglomerate of all the veterans organizations, like the, region and riders and working for that. But I'll do that on the agenda. I'm talking about it now, and I meant to. For January.
and we'll make a note then that in January that we want to have a review and discussion of that upcoming event.
Or just an awareness.
Awareness. Okay, that sounds great.
We will also do, alcohol compliance visits in January.
Okay.
Then Jamie and I, the medical examiner, are putting on a report for the scatter plot that we want. And that's coming. So you'll have. There's a lot of like.
Looks like we'll have a full flight in January then. That's good, we'll be able to. You have anything else to cover in that area? No, if not, I will entertain a motion to adjourn. Motion made, the second.
Second.
Second by Garvey, any discussion? All in favor of adjourning? Anyone opposed? Okay. Thanks, everybody.